The first successful kidney transplant in India was done just 50 years ago. Ever since, we've come a long journey making renal transplant much easier to handle today. Despite these advances, developing countries are yet to reach those numbers when it comes to transplant compared to developed countries. Now, why this difference? It could be several reasons. It could be lack of clarity in the policies, infrastructure, so many things. But lack of awareness among the people with regards to kidney issues and transplants could be one other reason. So here we are today to discuss this particular topic and to understand more about preparation for renal transplant. We have with us a wonderful panel today. I'd like to welcome the doctors who've joined us today from Manipal Hospital's Sarjapur Road. First, we have Dr. Pallavi Patri, who's the consultant, chief of nephrology, and joined by Dr. MANOHAR BHADRAPPA. He is also the chief of urology and renal transplant surgeon, both joining us from Manipal Hospital's Sarjapur Road, Bengaluru. Also on the panel, we have two guests, whose one is Miss Priyanka, right? Priyanka Gosal and Mr. Shrikant. Both have got their renal transplants done and started with a new life. They're going to be sharing their experiences with us a little later from now. So let's get on with the discussion. I'm Listy Prabhakar. This session is curated specifically by DH Brandspot for Manipal Hospital's Sarjapur Road. Right. My first question is to Dr. Pallavi. What is kidney failure? Let's start from there.
So yeah, the kidneys are very important organs. They have many functions. So they don't just clean the blood, they clear the blood of toxins, they maintain electrolyte balance, they maintain acid-base balance, they maintain your blood pressure, including your salt and water level in the body, but they have many other functions too. They help you with your bone health, they help you maintain your blood count as well. So yeah, they're very important organs, and they have, but kidneys can get damaged over time because of various diseases, diabetes being the most common, high blood pressure, okay? Sometimes medications can damage the kidneys, overuse of certain painkillers, for example. There are other genetic causes of kidney failure, such as autosomal dominant polycystic kidney disease. It may have been something you've heard about. It's passed on from generation to generation. There are some inflammatory diseases of the kidneys that can also damage, such as lupus. You may have heard of that. So there are many different diseases that damage the kidneys.
Right, right. So how does one know there is kidney failure? How do you diagnose it, per se?
So that's, so interestingly, so kidney disease can actually be very silent, and many patients may not even know that they are developing a kidney problem.
Right.
So it's really important that if you know you are at risk for developing kidney problems, for example, if you have a history of diabetes or high blood pressure, or you know that there are many family members and you have family members who have kidney problems, that you actually go in and get a general health check. And they're very simple tests that can be done. So blood tests to look for your blood urea and creatinine levels. These are toxins that build up in the blood, and the kidneys are responsible to clear them out. So where these levels are in your blood, urine tests to see if there are any abnormalities in the urine, such as red blood cells, white blood cells, or protein spillage into the urine. Very simple test to do. And in certain cases, you may need to undergo what's called a kidney biopsy to get much more information about what's specifically going on in the kidney.
Right.
There are also some imaging studies, of course, like ultrasound and CT scans that can give you an idea.
All right, thank you. And is this disease curable, or is it reversible by any chance?
So kidney disease, like I said, the symptoms can be very insidious, and you may not develop symptoms until you've really progressed with the kidney disease. And in other cases, kidney disease can come on all of a sudden. So there are reversible causes of kidney disease and irreversible causes of kidney disease. Very often when it insidiously builds up, like for example with a diabetic patient that has damage to their kidneys.
Over a period of time.
That happens right over a long period of time, and they develop what is called chronic kidney disease, where there's scarring that sets in the kidneys, and that becomes an irreversible condition. Okay, that progresses. Certain conditions, that, for example, that are inflammatory conditions of the kidneys that can happen all of a sudden, or bad dehydration, or certain medications that can affect the kidneys. Many of those conditions are reversible with treatments, certain medications. Yeah.
All right. That sounds good that some of the disease can be reversed. So how do you treat kidney failure?
So kidney failure, depending on the cause of the kidney disease, has various treatments. Sometimes we use, certain immunosuppressive medications to treat certain inflammatory conditions of the kidneys. So there are several different medications that we can use depending on what the kidney disease is. When we have chronic kidney disease, like I said, it's progressive, and you cannot really stop that process. There are medications that we can use to slow the process, slow that progression of the chronic kidney disease. But when patients reach a late stage, what we call end-stage kidney disease, and the kidneys are so burnt out that really they cannot survive with those kidneys, we then have to think about what are called kidney replacement therapies. So that includes dialysis, and dialysis are actually two forms of dialysis. There's a type of dialysis that can be done at home called peritoneal dialysis that we can do, and there is hemodialysis, which most people are aware of, that is done usually in a hospital setting. Yeah, can be done at home, but typically done in a hospital setting. So there's dialysis, and better than dialysis, if you're an appropriate candidate, is transplant.
All right. Who is, the next question I'd like to ask Dr. Manohar, because you're the renal transplant surgeon here. So what is renal transplant, and who's a candidate for a transplant to be done?
Okay. So what is renal transplant? The word itself says that we are transplanting a kidney from a donor to a person who has reached a stage, what as madam said, that is a end stage renal disease, what we call it as a chronic kidney disease, stage 4 or stage 5. When he has reached that stage, we transplant a kidney from a donor to that patient, and we transplant into the abdomen, and thereby helping him out is the functions.
Right, right. So how is the recipient prepared for such a kind of a transplant, Dr. Pallavi?
We go through a whole series of tests, head to toe. We do a solid cardiac heart evaluation to make sure the heart is strong enough for the patient to undergo, because many of our patients may be diabetic and may have other medical problems as well. So we do many different tests, including a heart evaluation. We need to make sure there's no active infection that the patient has prior to getting a transplant, active cancers, so we need to make sure that the patient is healthy enough to undergo the transplant. But in general, most patients that are deemed eligible for transplant in the right age group and are healthy enough to undergo it will do better post-transplantation than if they just stay on dialysis. For some patients, unfortunately, transplant isn't an option, and then dialysis becomes the way of life for them.
Yeah. So these transplants are done from living donors or cadavers. How does it go? I mean, let's talk about living to begin with. So how do you find a living donor?
So, living donors, so yes, you can actually get a kidney transplant from either a deceased donor, someone who's passed away, and for that you have to register with the state government for that. And then you can also get a donation from a living person. So you only really need one kidney, one well-functioning kidney to live a perfectly normal life. So that living donor gives one kidney, keeps one kidney, and that donor may be, so there are laws and regulations that we can discuss as to,
so maybe you can add some more to the rules.
So the thing is that the transplantation, coming to transplantation, there are types that like living related or living unrelated. The two types are there.
Right.
So what do you call it? If I need to explain more about the living related, means it's what you call it as first degree relatives and second degree relatives.
Okay.
Who comes under the first degree? For example, kids and kins, wife, spouse, and also the grandparents also comes under this first degree.
First degree.
The rest are all considered as second degree relatives.
Okay, okay.
So these people can come forward and help the patient who's really in need of a kidney.
The first and the second degree.
Yes,
relatives.
first degree and second degree relatives. Okay, then coming to this unrelated.
Okay.
Unrelated as like basically there should not be any commercial dealings in between the donor and the recipient.
Right.
And also there should not be any financial incentives between the unrelated transplantation. Means there should not be any financial incentives between the recipient and the donor.
Okay.
If you prove this, I think so the unrelated transplant can be, once the committee approves from the government, then I think so we can consider for the transplant between the two.
For the living donors, right?
Yes.
Yeah, yeah. So what about the health of the donor in such case, if they're a relative or not a relative, how do you go about figuring out the health of the donor? How should it be?
Yeah, see, what you're asking is maybe that who can donate
Correct.
indirectly.
Correct.
So anyone who is aged above 18 years of age, who is like mentally, who can take up the decisions, and anyone who is less than 60 to 65 years of age, then also coming to this, they should, preferably what we say is that they should not be suffering from any chronic illness or any cancerous conditions or any chronic ailment should not be there, who's healthy enough, then he can donate the kidney. And basically we also look into, they should not have any substance abuse, also one of the criteria when we look into the donors.
They shouldn't be on any kind of medication, they
Yes.
shouldn't be diabetic themselves.
Yeah, that's
right?
what. There
So
should not be any chronic ailment like diabetes
Anything.
or hypertension.
So sometimes, we do take donors who may be on thyroid medication, for
Yeah.
example, or one blood pressure medication with blood pressure that is pretty well controlled. In general, we do not, it is,
Not recommended.
yeah, not well, no, well controlled conditions. Someone who has mild asthma can donate. Someone who has a thyroid problem can donate, or blood pressure that's well controlled can donate. Diabetics we generally do not take for donation because they themselves may develop kidney problems in their lifetime. So basically, when we do a donor evaluation, we want to do when we're taking a kidney out of somebody, we want to make sure that it has as little impact as possible on their
Absolutely,
lifetime.
yeah.
And usually, donors do very well because they're heavily screened. You screen them head to toe, and they're actually generally a healthier subset of patients compared to the general population. So actually, if you compare donor health post-donation to the general population, they live better, they live longer than the general population. But if you compare donors who donated to donors who were sort of healthy enough to donate but did not donate, there is a slight difference in how what their risk of kidney problems and high blood pressure is in their future. But that risk is so low that overall, it's deemed okay by the international community for us, medical community for us to,
Go ahead.
Go ahead.
Yeah. So what about the health of the recipient who's once received now? What about him? How is it that you'll be screening him, monitoring him after the surgery?
Again, what Dr. Pallavi has told that the recipient will be thoroughly screened. Basically, he will be looking at this cardiac issues, and because of the chronic kidney disease itself, there will be so many, almost majority of the organs would have been affected because of that high toxic substances within the body. So we need to be evaluated thoroughly. All the organs like cardia and the pulmonary system should be looked into it. And also we looked into the psychiatrically, we will send the subject the patient to the, we will subject the patient for the psychiatric evaluation. And if the patient is a bit on the older side, 40 to 50 years of age, we look for the cancer screening also we come across. If there's a female, then we look for the breast cancer things also by getting a mammography done or a pap smear done to rule out the cervical cancer. So in this way, we thoroughly evaluate a patient before subjecting the patient for transplantation. And if by chance, if anything is there which can be treatable, will be treated, and we may not be able to optimize the patient completely, but near optimal, we can get the patient to that level, so that once we transplant the patient, definitely all the organs will start getting help, and the patient will do really well, basically.
All right. Now you were talking about registering with the government. So how does that work? So how does one register as a donor? Like a person like me, I want to donate. So how do I go about it?
Yeah, it's a nice thing. Basically, it's a simple thing. You can just go online when Jivasarthakate, which is the body which is there in Karnataka, and where you can register you online, and you can see that you can get a card who is a donor card, And by that way, you claim that you are eligible to donate the organ. If by chance, by God's grace, nothing should happen, but if by chance, if anything, the patient met with an accident, or he will be eligible to donate the organs, because the human body has got so many organs, about 78 organs can be donated.
Not many of us know that you can actually pledge, and if the person dies, then the challenge is how does it reach the the authorities to come and harvest it. There is a disconnect, right?
Yeah, yeah. So the thing is that basically in India the problem is that why this, that's the reason why the cadaver program is not up to the mark compared to the Western countries, because there is one more issue. Is the thing is that there's a family consent is the most important thing in Indian scenario.
I understand.
So the thing is, even the wish, even the patient wants to wish to donate the organs, but the family may not give the consent. I think so. We have to look into the policy and help it out, that how best we can help the donor who really wish to donate, and make his organs work even after his death.
Yeah. So that is a challenging, part of donation when it comes to India. I understand that. So you mentioned earlier that patients who need kidneys, if they don't have a living donor, can register for the deceased. So how does that? It works in a queue. How does it work?
It's a register. The central registry will be there.
Okay.
The hospital registry and the central registry will be there.
Okay.
So once the patient comes, like who was in dialysis, or at least for a month, so then he can go for the registration in his hospital, and also central registration also will be done. So if the patient, the ranking will be there, and it's all computer based, and the ranking will be there. Once we get to know that there is a cadaver which is with the organs can be harvested, then that 4 or 5 people will be sent to this cross matching, and we see that who is the best match for that kidney. Then based on that, based on the ranking, he will be selected for that transplantation.
That's interesting. And in India, cadaveric transplant is not so common, right, Dr. Pallavi?
Yeah, I mean, it would be nice for us to be doing more cadaveric transplants. Right now, the country is not so well connected, as you were saying, infrastructure-wise. It's not that organs really travel from one state to the other like they do in many other countries. And I think in general, there's a lack of awareness, as we discussed earlier, about, pledging organs and, family members getting involved in terms of donation. For, in some countries, there is what is called an opt-out kind of situation with organ transplants, for example, with Spain. So everybody is considered a potential organ donor on death.
Oh, that's wonderful.
Unless you specifically say that you don't want to donate organs. Okay. Most other countries, like in India, it's an opt-in system where you actually have to notify the authorities that you are willing donor. Exactly. So I think if we raise more awareness about organ donation and how dramatically it changes the lives of those patients who are stuck with end-stage kidney disease and are dialyzing, because dialysis really cuts short your lifespan in comparison to a transplant. It's a huge difference in the quality of your life, the health, your overall health, and your longevity. It's a huge difference.
There should be more awareness among the youngsters to, pledge for donation among
more awareness about in the colleges.
Yes,
among the youth, we have to say.
Correct.
Basically indirect way, they may convey the message to the family members that I have pledged, I think so you should go ahead if something wrong happens.
Recently also there was a death of a celebrity. He donated his eyes and the family did the needful.
Yeah, that's the way it should be.
Yeah, so when more people like that come, come forward to do such things, I think the awareness will increase.
Yes.
In fact, in our country, what happens is when we get to see that, when we notice that there is a probable cadaver, it's very difficult on the hospital part also to
tell the relatives.
Convey the message to relatives.
Because they are heartbroken at that point of time.
I think so, being a surgeon, I can say that that's the most toughest task rather than doing the surgery.
Yeah, so you see a kidney burnt into ash.
Yes, absolutely. It's just like it should leave.
I understand.
It should leave, and it should definitely it helps the one of the patient. It's not
Right.
one patient. 7 to 8 patients are helped.
Multiple, right?
Multiple patients are helped.
With the different organs.
Yes, and they live to the extent, full extent. That I think so. That quality of life is more important.
Correct.
Even if you live 1 year, I think so if the quality of life is good,
Right.
only the dialysis patient will know how difficult his life will be when it is on dialysis machine.
Correct. These transplant, because of technology today, is much easier than earlier days.
Yes.
Is that correct?
Our medications post-transplant, you know, the medications that we use post-transplant are much better now. So, you know, the biggest issues that we have to deal with for patients post-transplant is their risk of rejecting that kidney,
Correct.
right? So the patient's immune system tries to fight this kidney
New
that
thing.
seems like foreign and like an infection almost. So the immune system tries to fight it like it would fight any infection. So we have to give patients like pretty strong medications to control their immune system so the body actually accepts the kidney. But in that process, the immune system is weakened a little bit, so there's always this risk of infection. So, you know, post-transplant, we're always balancing this like risk of infection with rejection, but the medications have, you know, there have been so many advances over the years, the decades, that we're actually not so bad. We're pretty good at this, and that longevity of those kidneys has increased substantially.
Right.
And we're also able, if you lose one kidney, to do a second transplant, in some cases a third transplant.
Oh,
because
really?
yeah, so, you know, children can develop kidney failure, and, you know, over their lifespan, you can keep them going. And each subsequent transplant gets more and more complicated in terms of the immune system, and, you know, even, you know, the mechanics of it does get more complicated. But, you know, people can get 2, 3 kidneys in their lifetime.
And here I want to add this one. As the medicines have improvised so much, I think so even coming to surgical point, nowadays we do almost all patients for the donor nephrectomy, when we take the donation from the who's a living donor, we do it completely laparoscopic way. So if a laparoscopic way is done, so I'll be taking off the kidney from the beltline incision, what we call it a cesarean section incision. So it will be less than the cesarean scar. So the patient will be up and about in 2 days.
Okay.
He'll be back to work for 7 days. So he won't even know that.
The
only
donor,
thing
you
is,
mean?
Yeah,
The
only
donor.
thing is if he's mentally prepared, he will be back to work in a week.
Okay.
So he won't even know that he has donated the kidney.
Right.
And the body is strong enough that with one kidney he can easily
Adapt.
yeah. So I think so. And nowadays again the robotic is also coming up. So all these advanced techniques and technology what we are coming across is like helping the donor to get back to normal as early as possible. So I think so that in that way, if you look in that way, I think so we should promote more transplants,
Correct.
both as living as well as the cadaveric
Yes,
transplants.
I agree with you. And post donation, the donor, what are the things that he needs to keep in mind to lead a healthy life?
Yeah, basically, since he's been evaluated thoroughly, basically, so that means he is at the benefit rather than the risk. If a patient is not been considered for donor, that means that he doesn't know is he suffering from any ailment. So if a patient, for example, X, Y, Z or whoever is done, he will be thoroughly screened.
Right.
So we can always say that, okay, we will pick up if something is there. So that means if a patient is healthy.
That is prior the surgery. I'm talking about after the surgery. Is there any specific diet you give him, or tell him to follow this?
Yeah,
so
basically what is thing is, as we always say that don't stress your other kidney which is left.
Correct.
It's as simple as that. Don't put on weight. So if you put on weight, then there are chances that you get a diabetes or hypertension.
Right.
Will be more. Incidence will be more.
Okay.
So don't put on weight and have a healthy lifestyle. Do a physical exercise regularly and be on a regular visit to the hospital at least once a year, so that thoroughly you can maintain that you don't get a diabetes or hypertension, and even if it gets also, so treat it early so that the delayed effects will not be there on the patient.
But also, I think, donors become more aware, as you were saying, about their health, right? So that suddenly they're so much more aware about their health after donation. Other than living that healthy lifestyle, you do have to be a little bit careful about certain things, like certain medications. Okay, so if you've donated a kidney, any doctor that you see thereafter should know that you have one kidney.
You should keep them informed. Like
Yes, you should keep them informed because certain medications you want to avoid, like painkillers. We always tell even our transplant recipients, if you have one kidney or if you've ever had a kidney problem before, we want to avoid toxins to that kidney, avoid exposure to toxins.
Yeah.
So, for example, certain painkillers like Brufen, Voveron, Comiflam, these are called the non-steroidal anti-inflammatory drugs. They can damage completely normal kidneys if they're taken regularly. So if you only have one kidney, either as a recipient or a donor, you need to be careful to avoid these medications. You should be careful, in general going to, with your doctor, you should let them know that you have this.
So today, along with this discussion, I'd like to have a talk with both your patients here who are, happy with the transplant. Priyanka, if you don't mind, can you tell us how you realized that you had a kidney issue?
Yeah. So, like in 2016, basically, my pregnancy was terminated because of the hypertension I had developed during my pregnancy.
All right.
So in the 5th month, I got the baby terminated, and after that, in 2-3 months, when I was going for the checkup through the doctor, there seemed to be some issue with the protein leak and all, because of which, and the pressure was not coming down for me. It was still higher on the side.
Okay.
So that made me consult a nephrologist.
All right. Right.
I consulted a nephrologist, and through that phase, they prescribed me with some medications initially, which went on for 6 months. But still, I was not having that stability or pressure coming down to a bit, and bit of stable on the kidney side.
Right.
With the creatinine becoming higher and higher,
Okay.
it was moving to a higher side.
Okay.
So later, in that later phase, when it was quite higher, I think it moved beyond 10 or 13 something. And that time, my doctor prescribed, they told me that I had to go for dialysis.
They recommended dialysis.
Yes.
Okay.
So
Okay.
they told me that it is better to go for dialysis. And so in 2018, June, I started my dialysis.
Right. And if I can ask Dr. Pallavi, so how long was she on dialysis, and how does the story go?
So actually I met Priyanka after she had already started dialysis.
Okay.
And she's very young, and so the first thing I said to her is, you should transplant. We like to do, especially for young patients, we really like to, actually any patient, if they're a good candidate, to push them into transplant preemptively, even before they experience dialysis. Because dialysis, the longer you stay on dialysis, the weaker the body actually gets. The quicker you get into a brand new kidney, the better it is for the body. So actually, Priyanka was a little hesitant to consider transplant.
How old were you then? How old were you?
33 years.
Yeah.
My God.
So it was actually very sweet. She didn't really want to burden somebody else. If that, I remember her telling me this multiple times, with taking a kidney from them. So she stayed on dialysis for 3 years, even though she had a donor, a potential donor.
Okay. So who was your donor?
My mother-in-law.
Oh wow.
My mother-in-law, she came forward and she told that she's ready to give me.
That was
one
very
of the
nice of her. That
Yeah,
was
even
very
though she
nice.
had got multiple surgeries. Yeah, she had got multiple surgeries. She didn't hesitate to donate her kidney.
Oh, how nice.
Yeah.
How nice.
She was healthy otherwise. She was very healthy
was healthy,
otherwise.
yeah.
60 years old, right, when she
Yes.
donated. So
She just completed her 60, but she was quite energetic to give me and donate the kidney.
Absolutely.
Because she has seen me going through this dialysis and all, and it was at that time I was recommended for 4 times a week, 3 times, 4 times a week
Okay.
for dialysis, and 4 hours per day.
Oh my God.
It was like
That's
yeah,
quite difficult.
yeah.
And you had lost a lot of weight, right? You were she was very petite. So she's actually done very well. When with the surgery itself, so literally in the operating room, as the connections are being made to the new kidney, with the new kidney in the recipient's body, that kidney works immediately. So there's urine output immediately from that new kidney, and really dialysis stops right away.
All right.
So literally, we stop the dialysis right after they come out of we don't need it anymore.
After the
they
surgery.
yeah. So she did extremely well. Her donor is doing very well. She has very good kidney function. She's,
Yeah, her kidney function is somewhere around 1 or something.
creatinine level.
Post-donation.
Post-donation.
Yeah, she was very anemic before. It was very hard for us to get the blood count in a good range for her. After the new kidney has come in, like I told you, the kidneys have so many functions, right? So after the new kidney has come in, all her blood tests are really great. Her blood count is better than mine, I keep saying, and like all her labs look really good, and she's also very energetic and has gained, weight again.
Yeah, right.
More confidence. And, quality of life has improved a lot, as I say, always.
Definitely.
Right. So, what do you want to add to that, Priyanka, after the surgery and before the surgery?
Before the surgery, yeah, that was one phase, which I think it's quite unfortunate for some people. They had to go through that.
Right.
But yeah, I was fortunate because I had one donor from my home itself. And although it took some time with all the approvals processes, we had to go through medical tests and all, government approvals and all. But we reached that point where I was also stable to take the kidney as a recipient, and my mother-in-law was also fine to donate her kidney.
Right.
So that was a good thing what happened, and right now I can say it changed a lot of things in my body recently. My transplant happened in March 2021.
Okay.
So I am going to finish my 7 months or 8 months right now.
Post-surgery.
I am on continuous regular checkup with Dr. Pallavi, and there are medications which I'm taking regularly as prescribed and recommended to take it on time. My life is still, I can say my life is quite changed and it's very good now. I started working as well.
Oh,
I
wonderful.
was working earlier,
Right.
and I had to
Take
put
a break.
On that. And after post surgery, just a month later, I started
Working again.
Yes.
Oh, that's wonderful. That's good news, actually.
Yeah. So right now from home I'm working, but yeah, I am really good, and I would suggest people also to go through if they are having that option, an opportunity, they should go for it.
Right.
That's what I would suggest to everyone.
You recommend that they don't go for dialysis and go for transplant directly, is
Yes,
it?
yes. If they, there are limitations, we all know.
Yeah.
But yeah, if they're having that opportunity, if they have someone who, because family cares, right?
Right.
So if they have that opportunity, they should go for it.
Yeah.
And they should have that dream living with the family as well.
That's wonderful. That's a wonderful story. And the mother-in-law comes under the second list, is it?
Yeah, secondary.
Secondary.
Annulate.
Also, one point I would add for me is my family, my husband, my maternal family, my brother, my sister, they're all here in Bangalore. And the overall support which I got from my family altogether, that was a very, it was like God gifting.
Absolutely, absolutely. I agree with you. Thank you so much for sharing that with us,
And
Priyanka.
I want to thank the doctors as well.
Right.
Because they had this whole thing for me, and it went on very well. So thanks a lot.
One other question. Were you very skeptical about going for transplant? You felt safer with dialysis at that point of time? What was your mindset?
No, with dialysis, I was not that much happy. Though, didn't I had any other options that time. But I was hesitant because of my mother's age as well and her health.
Okay.
Because she just reached 60. And I was like under the impression that if she donates one kidney, how would she survive with one, right? It could be anybody. As a human, we should feel that as well, right?
Correct.
It's not just me, question of me, but for them as well.
Right.
So that thing was a bit of, which brought a kind of delay to change my thoughts.
Yeah.
But yeah, since it went well,
so your mother-in-law came forward.
Yes.
That's
yes,
wonderful.
Definitely.
All right. Thank you for sharing that once again, Priyanka. Yeah. Srikanth, glad you're here with us today. Would you want to share your story with us? How did you find out that you had a kidney problem, and how did things fall in place after that?
Okay, my case was a long-standing diabetes, and complication from that led to, I mean, it was uncontrolled and I hadn't taken care. So I initially, when I met Dr. Pallavi, I started with, blurry vision and stuff like that. Those were the
Symptoms,
markers, yes.
Okay.
And of course, rising creatinine and whatever when I got the blood test done. That's how I found out that, I mean, my creatinine levels had just moved to 2 and 2.5. But it progresses pretty fast after that. So it just like goes to 4 and things like that pretty quickly. So at the time when I met Dr. Pallavi, I had no clue about what the treatment methods are and stuff. Yeah, what I heard was that patients with CKD and end-stage kidney disease, they just end up on dialysis, or if they're lucky to get a kidney from application through the hospital and maybe a deceased donor, then those are the only two ways. And of course, I had heard about family members donating and stuff like that. But for me, somehow, I don't know, it was just very morally, I was very resistant to the idea of asking anybody for to go through this for my sake.
Right.
And I was pretty much prepared with the idea that I'll be on dialysis. When I met Dr. Pallavi, she completely reassured me about the fact that the success rate of these surgery procedures are very good these days, and someone like you should just go for a transplant straight away, even without dialysis, if possible.
Right.
And you should be, you should stop feeling so resistant to the idea that you can
somebody can donate and you can take.
And of course, initially, I mean, she also convinced me that the quality of life of people with transplant is so much better than someone with dialysis. And initially, I mean, my sister offered. I had a sister in the US who, older sister. She's about 54. And she had offered initially. And again, very hesitantly, I mean, I said, fine, I mean, if it's possible, then why not?
How old were you then?
I'm 48.
You're 48. So how long has it been since your transplant now?
It's been about 4 months.
4 months, okay. All right.
Yeah, it happened in July.
All right.
So, so my sister came down and met Dr. Pallavi, and of course found that she was ineligible to donate because she was also borderline diabetic.
All right.
And that's when I had an old friend of mine. And the one other thing that I want to mention here is that, I guess people who are patients should just speak about their problems, because I was one of them who never spoke about my issues with anyone.
Okay.
And there were very few people in my friend circle that I had spoken to.
Who knew that you had an issue. Okay.
And most of the time I would just tell them that I'm just going through some health episode and it's just something that, whatever. I may not be in touch for a while, so just, bear with me and stuff like that. And that's when a very old friend of mine from primary school came forward, and she said, I can't see you going through all this nonsense, and we just, this is some, and it happened in a very unique way, because she apparently wanted to donate, and she said, I've been wanting to donate as, as one of, that's one of the
She
things
wanted to donate a kidney?
Yes.
Okay.
I want to be a donor, and this is something that I wanted to do in my life.
Okay.
And if I can do it for a friend, why are you stopping me?
Right.
Why don't you just accept it?
Okay.
And then she pushed away and she came and met Dr. Pallavi, and the rest of the story they know.
Right.
And,
Dr. Pallavi, you want to add to what he said?
So, I think there are a lot of misconceptions about who can donate, as we discussed earlier. And this is a friend that he's had for decades, right? 30 years or something they've known each other. A very good friend, who was very eager to donate, And I feel sort of bad because, we did all the legal workup, and, this person was so, genuinely wanting to donate that she went through all of a whole litany of paperwork,
Yes.
legal stuff,
There
finances.
was a lot of scrutiny in terms of, the bank statements, and as the Dr. Manohar also mentioned, that there should be no monetary,
Legal,
monetary transactions.
Oh, yeah, monetary
between,
transactions.
and there has to be consent from all of the family members.
Right. All of the donors' family
Yes,
members.
and even if
Okay.
they have
That's
children.
what, this is where
Yeah.
the little bit of legality, I think so you should liberalize a bit. I feel that.
No,
Because
for a living donor, if the donor is willing to give, can the family object?
yes, you have to, if it is unrelated, definitely you have to get a consent
So
from
if
all
that
the
was
family
her
members.
lady
So
friend
that's
of
where
his,
the, that's
but
where the
husband
delay
can
was there,
object.
in fact.
Yeah.
That's where the delay was there, because the legality was like you have to get the consent from every of their family who is donating. So
all of this goes to, we don't decide whether, the patient donor is eligible legally to donate. It goes straight to the Karnataka state government. They look at all of this. There's an entire body that looks at all of this paperwork.
Okay.
And both of them were required to, hand in all sorts of things, like we said, financial statements, all sorts of documents and paperwork. And actually, it took us a long time to get to the point of
And
donation.
even proof of the fact that we were friends. Because
Right.
All
back
right.
back
Connecting.
at the time, we forget that, those days we didn't have such ubiquitous like cameras, every amount
Photographs.
of mobile cameras and stuff like that. So we had to
Then
get.
how did you figure that out?
No, we just had class photographs
Photograph.
from our classroom, like whatever.
But
the
you
school
don't look
photographs.
anything like that now.
Exactly. So, so we just had like proof of our names and
Yeah.
whatever the.
Did you get to go to school records and pull out the records?
Absolutely.
Really?
Yeah.
Oh, okay.
The legal procedures are all like, for better or for worse. I mean, they are there.
No,
and,
I think we
it's-
should respect that.
Yeah, we should respect that, because they're just trying to ensure that there's no
Absolutely.
the racket.
Absolutely. They're very clear about things.
Yeah. So yeah, after that is when I went through the dialysis, because the
During this
procedure-
waiting period, you had to
Yes,
actually undergo
yes.
dialysis.
Because by that time my creatinine levels had risen up,
Increased.
and after that is when we
Right,
got the
right.
approvals and from the
Came
health
in.
board and everything, and
Right.
got the dates for the surgery.
Oh, wonderful, wonderful. And how did things go with the surgery? It went well, and yeah.
the surgery was smooth, I think so. He recovered very well, I think so. I
Yeah.
think fifth day was discharged, if I'm not
Yes,
wrong. Fifth or
yes.
sixth day I discharged. That's even now, I will say that for cesarean section they take around 2-3 days, and my donor discharged on second day, and recipient got discharged on fifth day. Is back home.
Okay, okay.
Yeah, that's a good thing.
Yeah, both
It's
did
like
very
advan-
well.
They did very well, and his creatinine also dropped back to normal
Immediately, yeah.
immediately.
Yeah.
Thank you. Thank you for sharing your story. Before we close, doctors, I'd like to take a line from both of you, the advice to the viewers who are watching us today. Dr. Pallavi.
Yeah. So I think what I'd like to say is that, like I mentioned earlier, kidney disease can be very insidious. It can come on without you realizing that, that you have this problem. So make sure that you get your regular checkups done, especially if you know you have risk factors for developing kidney disease, or if you have family members who have a kidney problem. Just make sure you check simple things like your blood pressure and your general labs once a year.
Right. Thank you.
I think so. I want to say that kidney transplantation is a new lease of life. I think so. One should not be scared to come forward and get transplant done.
Right. So we heard that from the doctors. Get your health checkups done on a regular note to make sure your numbers are right. And do not fear renal transplant. The technology is such that the donor and the recipient will live a healthy life. Thank you so much for watching us. And I'd like to thank both of you for joining us, and the wonderful doctors from Manipal Hospital, Sarjapur Road. Stay blessed. Have a great day.